We're at the IAS meeting with Andrew Tan, and you're with the Community Advisory Group and Support Group over in Kuala Lumpur, Malaysia. And we really appreciate the work that you've been doing. We talked earlier about the fact that some of the videos that we've done with you have been useful for you and for the community. And we appreciate that people are going to be looking at those in a way that they can appreciate the need to become involved in their care and involved in their adherence especially. So tell us about what you've been doing, Andrew.
Ever since I had a chance to be interviewed in Kuala Lumpur, the videos have been very accessible to the community. And what has happened is that when I introduce myself to any new patients who are newly diagnosed, they may not be in the mindset to meet me at that point in time. So what I do is I forward them the videos so that they can be comfortable with seeing me and hearing what I say. And in that way, they feel that they have the upper hand of knowing more about me than I do about them. And I think that gives them a sense of comfort that they are in control of the situation. And when they feel comfortable enough with me, they initiate the decision to meet me face to face. And that's when I can do more of a face-to-face counseling and introduce them into a community support group. Usually it takes a lot of time, because for me, it took me 8 years to even join an NGO. And I realized that the 8 years for me was so much of a wasted time, because I could have healed a lot faster. I could have become a lot stronger a lot earlier. And if I can help it, I would like to make sure that the new people who are getting diagnosed today, tomorrow, next week, don't have to spend that much of time in limbo, waiting for help.
And depending upon what your government is able to offer in treatment at a point in time where it's within the guidelines and also within the ability to pay for the treatment, people should be very, very embracing of taking that treatment, because it is not only life-sustaining, it's life-improving, it's healthy, and they can mix it with their exercise that they want to do, and also good nutrition. Obviously, not doing bad things like smoking and drinking, and certainly to an excess.
Yes, that's true. We are very fortunate in Malaysia, because the Malaysian government does provide the first-line antiretrovirals free of charge, and we have what is considered to us very good regimens. The missing missing piece in the puzzle basically is treatment literacy, is for the community to understand why they're taking the medication. Of course, with the World Health Guidelines, starting people on treatment when they are tested, it proves a challenge, because the government has to invest a lot more money to treat everyone.
So that's something you and they should advocate for.
Yes. Yeah. At the same time, the government still maintains to start people on treatment at 350, and in special cases, the doctors have the chance to actually inform the patient, and in some cases, the patients can opt to start early as well. Which also comes back to the preparedness of the patient to start medication. We realized one thing at this conference. There's a lot of talk about the newest medications and how a lot of the doctors should switch to the latest combinations. But one thing that we realized is that for us in Malaysia, the combinations are going to cost a lot of money.
The newest ones.
The newest ones especially. So in terms of investment, it's going to take a lot of commitment from the people in charge, as well as a lot of times when you try to start people on treatment early, they will ask themselves, or they will even ask the doctors, I don't feel sick, why should I start medication? Because a lot of times when people think about medication, they think that it's only when I feel sick that is the time when I need medication. So to convince them that they need to start medication at CD4s of above 500 when they don't even feel any effects of the virus in their bodies takes a lot of convincing.
Well, it's a science. If people don't understand the science, I can understand that. But the most important thing is that people should understand that a lot of effort and understanding has been put forward by the scientists to answer the question scientifically that it is very important to start the treatment almost as soon as you can, by virtue of the fact that you're able to financially get the drugs in your hand and take them, but also by the virtue of the fact that your process or the progress of disease is going to be far less bad. It's going to be very almost innocuous. The treatments are their side effects are very minimal, and they're definitely tolerable. I mean, there are things that you can just say, hang on, it'll be getting better and so forth. But the importance is that if, regardless of whether you feel bad and bad enough to get on treatment, or whether you don't, it should not be an issue. It should be an issue of being on there when you're able to get on, because as soon as you can get on, the better prognosis you have for treatment down the line and for long term.
What we do believe in is that we as a community have the responsibility to help the new patients get prepared. Because when I started my medication, it was still at 200. My CD4 was below that, and when I started the medication, it was monotherapy, AZT by itself, and the side effects were horrendous. But the thing is that I saw the progress of the medication over the years. And now when I look at the medication where it's 2 tablets a day, 1 tablet a day, and there's still refusals to start. So we talk about the pill burden, and the pill burden now has been reduced to such an extent that that challenge has been met. But the thing is that there's still refusal. So we look at it as there is a psychological barrier to convincing people to start medication, and that's where the community comes in. The community can provide the efforts to change the mindset and to assist the doctors to start people on treatment a lot earlier, because it's by example. It is also to provide them the support that is necessary, because it is a big step to be committed to taking medication for the rest of your life. And so that's why my passion is on treatment literacy. It's something that I learned in 2010, and ever since then I've been so excited about it, because I thought, I've been HIV positive for 16 years in 2010, and why did it take me so long to understand about treatment literacy? I speak English very well, and what was the challenge that it took me so long to actually even comprehend the medication? And I was so excited about it. I brought it back to Malaysia, and I started developing it for the local community, translating it into Mandarin, translating it into Bahasa Malaysia, so that I would reach a little bit more people. And over the years, we've been doing the treatment literacy workshops, and eventually what happened was that APN Plus in Bangkok realized that I'd taken it to a different level. They were very pleased with it, and they managed to find funding to train 7 countries across South Asia on the treatment literacy programs. So the countries were Afghanistan, Bangladesh, Bhutan, India, Nepal, Sri Lanka, and Pakistan. And these countries sent their representatives over to Bangkok. We had a session on treatment literacy. They took it back, and they started translating it into the local languages. And now we have started launching it in each country, and these modules have become their property. They will grow it. They will develop it based on the needs of the community. And it's something that can grow, and eventually I hope to learn from them because they will take it to levels that I've never dreamed of. And when we did one workshop in Nepal, after the 3-day workshop, somebody came up to me and said, I've been refusing to start treatment. Now that I've gone through this workshop, I'm ready to go back and tell my doctor I'm ready to start. And that really surprised me. I thought, wow, we've achieved something here. And it made me very proud to be part of that process.
Some people need that support, some people need that assist, some people don't, but it's nice to know, it's really important to know that it's there for those that need it.
Yes.
It really is.
It is important because I think I would have understood a little bit earlier if I had the opportunity to learn a lot more. But I
But
believe
when
it's
you
also,
began treatment, it was at a time where that was what the standard of care was.
Yes.
And unfortunately for you, but fortunately for those today, there is a big advantage by being able to start earlier. It's a huge advantage, and like you said, starting earlier is important, but starting it and actually taking the pills is what you have to take the pills.
Yes, that's
and
right.
you have to take them when they say to take the pills.
That's why even till today we are losing people. Last year we had an issue with a young man who passed away, and he did everything that was necessary. He went to see the doctors, he got his prescription, he went to the pharmacy, filled the prescription, he took the medicine home. The only thing he didn't do was open the pill bottle and put the pills into the mouth. After he passed away, his friends and his family went to the room and tried to clear his things, and the friend found bottles of medication unopened, and it felt such a waste of life when he could have been treated and regained his health. And I questioned myself, what could have the community done differently to provide him that kind of support, whether it's a support system, whether it's linking him to a group
Or a buddy or something.
or somebody who would just help him with that strength. And to just call him initially at a certain time of the day and say, have you taken your meds? And to have somebody realize that there's someone somewhere who cares.
We're all worthy, and we
Yes.
should all be on treatment.
That would have made
Yeah.
a lot of difference, I believe.
Yeah. I appreciate you so much, the work that you do, and where it would go. It's an evolving process,
Yes.
and the work that you started is growing.
Yes.
And-
And one thing is that I really like to inform the people that if they need information on Malaysia and on treatment availability there, they can always reach us at myplus.org.my at gmail.com. So it's myplus.org.my at gmail.com. So we help anyone who's watching this and realizes that they just want to reach out to speak to someone. And
You're a
we'll
very
be
giving
there.
person. Thank you so
very
much for doing the work.
Thank you for the opportunity.
Yeah.